sex, baby. Let's talk about you and me. Let's talk about baby. Let's talk about sex.
Hello, hello. Welcome back to Revive 360. Today, we're going to talk about the big voodoo topic that nobody ever wants to talk about, but everybody wants to know, sexual health.
Yeah, I didn't notice it until right now. I love it.
So, why is it so hard to talk about sexual health? One, it's really how we're raised, right? I mean, sometimes families just, we don't talk about it. It could be, treated as something that's very private, even maybe something that's shameful in some cultures or some families. There's a fear of being judged, misunderstood, dismissed, especially for women. When, even with going to a provider, it's hard to ask a provider about sexual health because are you going to judge me? Are you going to think something less of me? Are you going to think, I'm out doing something that maybe I shouldn't be doing? And if you don't ask, then I'm going to also take that as maybe, oh, it's not important. So it can be really hard for a patient and provider relationship to have those conversations. But sexual health, it is connected to overall wellness. It's tied to your hormones, it's tied to stress, sleep, chronic disease. So it really plays a role. And when we talk about, how do we even learn about sex? I mean, if you're from a family that maybe doesn't talk about it, where do we learn it? I mean, men typically are going to learn it from peers, media, pornography, jokes, cultural harassing, from each other. So now you have men that are learning things off of the internet, and we all know lots of that maybe it's true, maybe it's not. So there's always, those issues that come along with it. And of course, some of those videos, I know you've seen them and the pizza man shows up at the door and you think it's a panty dropper. Well, it's really not. But if that's what men are going off of and think, oh, this is what my girl wants to see.
That information.
Yeah. And then you come home and try it. And your woman's like, go put your clothes back on. So, there's a learning curve, and I think we need to be a little bit more open and be able to talk about that. For women, where do we learn our sexual health and values from? Family, safety, family planning. It's always, drilled into us. One, we can get pregnant, so what are you going to do to prevent that? Or if you're not going to prevent it, and then it's always, stress, safety. Are you being safe? Are you going to end up with, an STD? So there's just a lot of stress, and nobody talks about, really the importance of it in a marriage.
It's like the complete opposite for men versus women. As women have to be scared of it, and men just go off and learn all of this crazy stuff that they think
right.
About.
And it's, the lack of knowledge when it should really be a pleasurable, desired thing in life. We should be you shouldn't feel guilty or bad about that. It's a very important part of our relationship and our health and our well-being. So it's not to be dismissed. Some of the big myths about sexual health is that when you become old, it's normal just not to want sex anymore. And that's really not true. If you've been married for 8 years, sex might not be as what it was when you first met. When you first in a new relationship, intercourse might be something that happens every day, every other day. It could be very frequent. But when you've been married for 8 or more years or in a relationship for that, it's normal for that to fall not so frequently because you're falling in love with that person. You're loving that person for a lot more reasons than just that sexual attraction. So in that regards, yes, you can have definitely less intercourse, but it doesn't diminish the relationship that you have. And just because you get older doesn't mean you should stop having intercourse. Sorry. The anatomy of the vagina. I know, as providers, I think you've probably had it too, where when women come in and we have to put in a Foley, they don't realize that we even have an extra hole to put a Foley in. So, I mean, women, if we don't know our anatomy, you know the men don't know it. So just to, I mean, Dominic's kind of drew a picture of Mariah here, but just to, really just kind of get an overview. Right at the top of the vagina, we do have a clitoris. And then right below, in the vaginal opening, you do have your urethra, and then you do have a vaginal opening, and then your anus. So if you haven't ever seen your vagina, you should take a mirror and look at it. Like, you should know what your anatomy is. There's nothing wrong with that, And what was our rule in our house? You can touch yourself, but you can't touch other people's privates. So you should know your own body. Like, that is a normal thing of development. The clitoris that's located at the top of the vagina, just so you know, has 8,000 nerve endings on it. The top of a penis only has half of that. So the clitoris is a very pleasurable part of the vagina that can really have, I mean, most women do have orgasms. Clitoral is orgasms rather than penetrative orgasm. So that is completely normal. And that's just anatomy. That's not because men, are better than others or this or that. It has nothing to do with it. It's just strictly anatomy, and that we have a lot more nerve endings there. During intercourse, the vagina does lengthen, it expands, blood flow increases to that area. And then you have vaginal tone. And we get this a lot too, is, oh, I've had a bunch of babies. It's not tight down there. Or maybe you're a virgin and it is really tight. Is it going to hurt? Like, what's going to happen? Like, what are the differences in vaginal tone? And one, if it is first time or you have not had intercourse before, it's very tight, and it can be just very painful. There can be discomfort into that. If you've had a couple of children and you feel like, oh, I'm loose or it's not good enough, well, that's not true. The vagina is a very dynamic organ. It really it's very fluid and can change. So if you've had children and you have less tone to your vagina, it really doesn't affect the men, because that's not what they're going off of. It really affects more you on, like, if it's tight, you're going to have that more friction and pain. If it's loose, then you might not have that pain, and it comes down to better lubrication. So there is that. Few questions that we had that, is it normal to have low desire after childbirth? And the answer to that is yes. And that's because our hormones shift again, right? I mean, you now have your estrogen decreases, your testosterone, because you're breastfeeding, you've just had a baby, you've built up these hormones for 9 months, and then you deliver this baby and they all go. So that is normal to have that little bit of a lower libido, especially after childbirth. So that is a normal thing. Why does sex become painful after menopause? That one is usually because hormones again. You get that drop in the hormones and you can get the vaginal dryness. Because estrogen declines, it starts thinning the walls of your vagina, which can cause more pain. Testosterone drops, and that's more of your libido. Oxytocin, dopamine, all of those play a role. So having a decrease in all of that does play a role in that. We'll talk kind of about how we can help with some of that in a little bit. Some of the other questions we had: can hormones help with libido, and are they safe? Do you want to answer that one, Mariah?
Yes and yes.
Yeah, so I mean, hormones do play a role in that, and they are safe. They've released, I know we've talked on it several other videos, they've released that black box warning now, so women can have hormones. Sorry, there's a nice place here.
Next one is, does vaginal dryness always mean menopause?
And that No, obviously, if you're on hormonal birth control, and we've talked kind of about that too, we put these girls, these young girls on hormonal birth control when they start having their periods because they don't like the cramps or they're irregular, and providers like to put them on that instead of just letting the natural process kind of happen. And when you put somebody on hormonal birth control, you're basically putting them in menopause, essentially. So yeah, you can definitely have vaginal dryness. You can have low libido through all of that as well.
So it's really the birth control's fault more than anything, just from it.
Yeah, at that point. One of the things with vaginal dryness is there's only about 10% of women in the world that can actually produce enough vaginal moisture for penetrative sex. And out of that 10% of women, it only happens about 10 days out of that month. So unless you're one of those 10%, which I mean, that's a very low percentage when you're looking worldwide of women. And if you are lucky enough to be that 10%, it's only during arousal are you going to get enough vaginal moisture for intercourse 10 days out of that month. So really that kind of leads us in. And Price, maybe you could talk about it because I know we sell a couple different lubes and we've talked some about it in the past, but the pH of the vagina does play a role in which lubrications we should be using, correct?
Oh, completely. And that's why if you've ever gotten, itchiness, dryness, redness, things like that, from using lube, it's usually because it's not a pH balanced lube. So basically, we've got two really good options, either Velvet or Good Clean Love, but they're both pH balanced. They're biomatched to have the same microbiome as the vagina already. So basically, it's like putting your own lubrication inside of you. And they're aloe water based too, so super easy to wash off. They don't get really sticky or tacky or anything like that.
So I shouldn't be buying the KY on the shelves at the drugstore.
No, because they've never cared to do any testing into that at all.
Because that's what we all go to, right? I mean, that's what's at the grocery store, so it must be good because that's what's there.
Yes, and then you go and use this, and you're like, oh, it shouldn't feel like sticky, tacky glue. It should feel like a liquid lubrication.
And I mean, me not knowing that for years, and you just buy what's off the shelf, now knowing, the importance of keeping everything pH balanced and the importance of lubrication, explaining that to my husband that, he needs to put that on. And that was a conversation we had to have, which again, I mean, if you're not in that kind of relationship, those can be difficult, right? I mean, especially telling your man, oh, sorry, you can't have penetrative intercourse with me without using the proper lubrication. But it really does help because one, I mean, I think, well, men are they're visual. They want to please their partner. It's more about a lot of times pleasing your partner and not so much yourself. Or that's how you get aroused as well. But, by not using lubrication, especially if you're menopausal or even perimenopausal, or have any of the symptoms that are somewhat mimicking a menopause, and you don't use lube, you're causing a bunch of micro tears in the vaginal wall. So then again, if you're not using lube and then they're leaving their deposit in there afterwards, you're just creating an environment for bacteria and infections and yeast infections, bacterial vaginosis, and all of that. So, I mean, I think being able to have that conversation and explain to your husband or partner why this is important, I think they would have buy-in. I mean, do you agree?
Yeah, and just how you're saying, at least a lot of men can be focused on their partner's pleasure. So usually with you just saying, this feels better, it is better for me, usually that's enough. I mean, if it means that you're going to more comfortably have sex with them more often, yes, I don't see why it would be a problem to any of them.
Exactly. Can birth control affect intercourse? I mean, I guess essentially the answer would be yes, because you're again messing with the hormonal balance of a woman, and that's what we're driven by. I mean, so for women to have, I mean, the hormones for us and to have intercourse would be testosterone, which is really your desire. That's what makes you want to have intercourse. Estrogen is going to be like the comfort because it's providing that your vaginal walls not to become thick or thin, sorry, to allow the integrity of your vagina. Dopamine is going to be more the excitement, the lead up, the foreplay, where you're releasing that dopamine. And then oxytocin is the connection. And oxytocin is really what we get released when that baby comes out. You get that big release of oxytocin when they put that baby on your chest. And that's why you fall in love with that baby as soon as they lay there, because you get that huge dose of oxytocin. And that's why they do that kangaroo care now. Another fun fact is if you hug somebody for at least 20 seconds, you get that release of oxytocin. So it's important that if you're going to hug your partner, that you do it for 20 seconds so you get that extra connection. Excuse me. Ways to release dopamine. Do you want to hit some of those, Price, and we can kind of go over just ways like that help release that dopamine to make women maybe want to have sex?
Okay. Yeah. So just as it is very mental for women. So there's a lot more aspects that go into it. Men can just be ready right away. Women usually need a buildup of some sort. So obviously building anticipation. So either obviously meet them wherever their love language is, but build up with flirty text messages, words of affirmation, things like that. Then we can go to, I guess, spicing it up a little bit. Don't try to do the same routine every time. Change routine. Even peacocking type things, show off a little bit every now and then. Show that they're worth your time and energy, basically.
Right.
That you don't expect anything, obviously.
Just don't show up with the pizza.
Exactly. Don't show up with the pizza. Show up looking your best and with some flowers and some chocolate or something fun, a fun game night plan, something like that. Just something to spice up their life. They're not either dealing with kids every day with the boring mundaneness. That's never going to get you in the mood. You're never going to be in the mood working your 9 to 5 every day and it all just being the same. But
sometimes having kids, I know, can be a buzzkill because you got kids running around, but sometimes you can actually turn that into maybe something fun. Like maybe you go hide somewhere that maybe the kids can't get to, or it's something that you can turn into a game or something fun.
Yeah.
But the kids are in, or for a nap, maybe we can run and go do something.
Yeah, and I feel like with kids, it's really easy to build routines, so that's where spontaneity is still a fun aspect to it. But just obviously, like I was saying, affirmations, words of love, things like that. Just building them up, making them feel confident, wanted, desires, things like that. Also, and then obviously, a big one is touch, but touch with nothing expected afterwards. Is hugs, kisses, holding hands, touching legs, stuff like that, but not for any purpose besides to show affection.
Right. Affection without expectation.
Yes, that.
Even though men are hoping for the expectation.
Yes.
Let's talk a little bit about foreplay and intercourse. Women, men are very visual. Make eye contact with them. Body language that shows that you're interested. Go a long way with men, that you're engaged, interested into the pelvic movements during intercourse. So again, like we had talked about vaginal tone, and it's not necessarily like because I've had 6 kids that, intercourse feels any different to my partner. It's that it's the love, it's the connection. It's not that because your vagina, again, is dynamic and will change and adjust to all of that. It's about reinforcing that love and making them feel wanted and that you're engaged in that. Touching the scrotal area. So some men can like that, some men don't, especially if you're, maybe you've had surgery or an injury there. It's a very sensitive area. I think, Mrs. White had always said, I don't know why they said, your men are, tough, balls are tough, or, that kind of language, when really the vagina can take a pounding, is what she said. Yeah. Like we're way more tougher than men. Like you kick men in that and you put them down. So, if you are going to touch that area, please obviously be very gentle and know that, look for men's cues, if your partner's cues, if they're actually enjoying that or not enjoying that. So that would be something that can be done. As far as men, like Price said, really women need that affection. They need that dopamine, that oxytocin release, so it puts us in the mood and without rushing it. I know sometimes, you know, men feel like, oh, just a quickie, like I boom boom, thank you, ma'am, let's get in and out. And women aren't like that. We really need to be eased into it. We need that affection, that love, bring us to that moment and give us that time. All right. One of the big things that I think a lot of men have a problem with because they think it diminishes them, toys in the bedroom. So, what's a good way to introduce toys into the bedroom?
If someone's intimidated by them,
Yeah, like how does, because we all know that women are, I mean, we have 8,000 nerve endings in our clitoris. We know we probably can have an orgasm that way versus penetrative sex. I think only 10% of women actually can have an orgasm with penetrative sex.
Yeah.
75% of women don't orgasm from regular sex.
That's a lot.
yeah, most of them.
That's most. So most of us do. So, I mean, knowing that, and now you have to explain that to your partner, because I think, you know, a lot of men think, oh, if you're bringing a toy into my bedroom, it's because I'm not adequate enough or I'm not doing it right. And that's not true, right? I mean, anatomy is anatomy. Like,
Yes, you work how you work. It's not.
yeah, I mean, it has nothing to do with that connection, right? So, like, what would be like a good way to bring that, or at least let men know, have that conversation, I guess.
At least in my opinion, is let them know they're obviously adequate enough. But I mean, we've had people working on these for years and years at this point to do exactly what they do to achieve orgasm as fast and comfortably as possible. So, I mean, first off, I like to think of it more as a tool in your tool belt than anything else. It's not taking over the job. It's
Right.
more of an,
Just to enhance the experience.
yeah, exactly, and make sure that everyone's having a good time. It's should be a pleasurable experience 100% for both partners.
And it's something like men could, I mean, you could use the product on your partner. It's not something that I just have to go do by myself, right?
Yeah,
It's
exactly.
something
It
that we
can
could do
completely
together.
a couple's toy, solo, however you want to use it. But
Right.
yeah, I feel like if you're intimidated by it, I don't see why, just because it's something to help make it easier for you.
And that's like, I think the hardest thing. I mean, especially young couples. I mean, I remember being young, and because we don't learn and we don't talk about sex, so you don't know what you don't know. And if your culture was, oh, we don't talk about that, and your husband's learned everything he knows from the internet. So, and we're afraid to say anything, it can be really hard to have these conversations. And then you get to my age, and I'm like, oh, no, no, no. Like, this is what we're doing. This is how we're doing it, because you become familiar with your body. You know what you like and don't like. And I think those conversations definitely become a lot easier when you hit 40, 50. But really, it'd be nice to have had those conversations in my 20s, because I could have saved myself a lot of heartache or feeling like maybe I wasn't adequate enough or I was doing something wrong, or vice versa, because I think men have the same feelings. We just don't ever talk about it.
Yeah, I think to add on to that, one of the biggest things that I've noticed that helps is just first off talking about it afterwards or just on the side and seeing what the other liked, what they enjoyed, things like that. And then you can obviously reincorporate those things, and then just having conversations about what you're interested in or what you found that you like personally, or hey, I like that you do this, but I think if you do it this way, it'll be a little more pleasurable for me. But I think those conversations are less and less uncomfortable the more you have them.
Exactly.
And then at some point, it's not uncomfortable because if it's your partner that you love and trust and spend all your time with, why would they not want to know how to pleasure
Right.
you as well as you can, basically?
And I think that at least for women, I feel like that's what I've learned at my age is, yeah, men want to come to the table just as much as, we do. And it's, yeah, I mean, they're all about us as much as we are about them.
It's just
So
hard to start the conversation on
yes,
either side.
exactly. Where I think, at least when I was younger, it was all about the man. Like it was important for the man to have an orgasm. It was like really sex was just for me to have a baby. Like there wasn't supposed to be pleasurable. I was just supposed to allow it to happen so I could have a baby and create a family. And that's really not true. I mean, men want to pleasure you, and that's what makes that arousal, is for the man to know that you are being pleasured and that they're making you just as happy as they are feeling having the intercourse. So with that said, I mean, we'll kind of go into after sex. So some of the things that I guess not myths is, or myths is the vagina is a self-cleaning organ. We don't need to douche after sex. That was something that was, when I was younger, that was something that, oh yeah, see, we had to douche every time we had sex or after every period because we had to clean the inside of our vagina. And really, we don't do that. It cleans itself, for one. You don't want to use douches. It really just changes all the bacteria in there and can lead to yeast infections, bacterial vaginosis, irritation. Urinating after sex is a good idea for both men and women, though, because it does get any kind of bacteria maybe at that urethra opening, so you don't end up with a UTI. So that's not only for women, but for men as well, which I think we don't talk about men doing that. I know that's something that women have always kind of said to do, but men should be doing that as well. And then cleaning the outside of your vagina or your penis with a warm washcloth and clean washcloth, mild soap, fragrance free, so you're not getting anything inside of there, is also appropriate. I know as women, we feel like we need to, because especially if something was left, a deposit was left in there, we feel like we need to go clean up. But men should be cleaning too. And even more so if you're uncircumcised, that you really need to make sure that you're pulling that foreskin down and making sure that you're cleaning so you also don't get an infection in there as well. So I think that is something that should also be said. But as far as that, if we do end up with a bacteria or an overgrowth of bad bacteria, not our good bacteria, we do have a couple options here, right, to help fix some of that, fix our pH.
So best option for at least really quick results is Good Clean Love Reset. It's a vaginal suppository, so you're putting those good probiotics right where they need to go.
And it works like that, right?
Yes, in a few days you have the results you want. Otherwise, if you don't want to have to do a suppository, we also have an oral pill. Let's see it out here.
Did we not bring it up?
No, but we do have an oral version that's the same exact probiotic strains, but you have to eat it. So
it takes a little bit longer, right?
Takes about a month or two.
Oh, okay.
And then this is about a week.
Yeah, so this one's a lot faster.
Yes.
So let's say, there's a lot of products on the market for women specifically because, the vagina, maybe it smells off or there's an odd color discharge. And so, there's all these companies that make these scented wipes and these pH scented washes. And, there's a whole section at Walmart just dedicated to that. But why should you avoid that? And why would a suppository like this be your better option, when I know they market all these different fragrant wipes at the store?
Because we don't want a fragrance attached to it. And then also we want it to be perfectly pH balanced. But the main reason is this is getting to the root cause of the imbalance of microbes in the vagina, whereas that other stuff is never getting to that. It's just a cover up or a band-aid, whereas this is actually fixing the issue at hand.
So essentially that's a waste of money, and you should really try to focus on fixing the bacteria than just trying to use these fragrant washes that are marketed toward women who think that we're taught to think that's wrong and that's not okay. So you're nasty. You need to clean better or this and that, but that's not the case.
No, not at all. It's just you have an imbalance of bacteria.
I just think it's important to note, because I know as a woman myself, like, you're always wondering about those things, and if you don't know, you don't know. You just see the stuff at Walmart and you're like, oh, it says I'm supposed to make it smell better, I guess we'll do that.
Yeah, your vagina doesn't need to smell like a rose, but it shouldn't smell like a fish.
Yes.
Awesome. All right.
And really, if you do have like an odor, that means that there is like some overgrowth in bacteria, and you would want to work on that, because there really shouldn't be really any smell down there at all. And like I said, you don't need all the perfumes and all of those fragrances down there either. that's not appropriate. You just need to keep yourself clean and keep that normal flora of bacteria, which also goes into like, we've always talked about the gut-brain connection, but the gut also connects down there too. So all of that is all connected. So what you do eat does show up down there. So it is always good to have that good bacteria, good probiotic. So everything is.
And I also just want to reiterate that that's why you want to definitely focus on using a pH balanced product for your vagina, because like Trinity said, it is a self-sufficient organ. It cleans itself. You don't need to be adding all these things, but if you have a bacterial imbalance, that's where these pH balancing lubes, the suppository, the different products they're about to discuss, that's why you want to look at those more so than these cheap, easy grab things at Walmart.
And as far as Revive goes, I mean, if it's something that maybe you are embarrassed about picking up, you can always reach out and text us. We can have it in a bag ready to go with your name on it. And you can just let us know, hey, my name's Marie. I'm here to pick up my product. That way, in case anybody was in the store, or you don't have to feel embarrassed, it's already in a bag for you to pick up. If that is something that concerns you as well, because there is no judgment. I'm happy to talk about anything. I talk about my sex life all the time to clients, and my poor husband probably just dies a little bit every time I talk about it, but I'm sure he's somewhat used to it now because I tell everybody anything they want to hear. So
we are getting close to time, but I would like to see more about these products that you guys have on the table. Can we kind of, maybe one of you want to take us through the different products and what they can be beneficial for?
Okay, let's start off. So this one we talked about last time or the time before. It's Feminescence Pro, but what it is it's 3 different strains of maca that are all concentrated into one pill, and it is proven to be the best natural remedy for helping with women's hormone levels. So if you don't want to, if you don't want to drink it because it tastes awful, the pill form is what we got.
Well, some people like it.
Yes, I did not think it was too delicious.
Yeah.
But it's just a really good option for hormone optimization without taking actual hormones themselves. And then we already
kind of talked about all of them.
Besides the
in the movie.
Oh, Vulva.
Yeah.
That's my favorite.
Yes. That's this guy right here.
So that is going to be a DHEA cream. You put pea-size amount on your finger. You do it clitoris to anus, so it is for females. It helps restore really your vagina. It brings the fullness back. It helps with the thickening of the vaginal walls. I like to say sometimes when we get older, kind of the labias look like roast beef and they get real thin. And that helps bring volume back. It does help with lubrication, so you're not so dry down there. It does help a little bit with libido, not a whole lot, but it does help. So I love it. It's usually applied once a day. At the beginning, I actually did it twice a day. I really liked it. I've now dropped down to once a day because it's brought back a lot of the volume from being in menopause for so long. So I absolutely love it. It's one of my favorites. And speaking of fragrance, even though I say you don't need to have a fragrance down there, it does have a little bit of a rose scent to it.
And it's just because, so they're putting actual rose hip cells in there, but it's beneficial for the vaginal walls at least. So it's a scent that it's at least completely natural and is helpful.
It's not a perfume.
Yeah, definitely. Which is nice. They're not putting anything in there that's going to be.
Yeah, that product is great. I absolutely recommend that to anybody listening. So that would be a top 5.
And then, do you have any questions?
No, we had a couple people join in later. So if there was like any of the biggest takeaways that anybody should take away from this talk today, what would that be?
I would say for
hormones. I mean, hormones play a big role, whether you're 20 or 50, depending on where you are. And that's a conversation you can always come in and have either with me, Mariah. You can make an appointment with Mariah and really get in depth because hormones are not a one size fits all, right? I mean, you really have, as a provider, I'm sure you have to really listen to your patients, look at labs, look at all kinds of things to know like really where you're going to meet this patient at. and obviously age, birth control. I mean, there's just so many things that can play a role in sexual health, but it is something that I think you should be comfortable talking to your provider with. If you're not, I mean, I know Mariah's very comfortable talking about any of that and obviously has no judgment. She's grown up in this family. And we've talked about sex since beginning of time. So there's really not much that I think you're willing to not talk. I mean, ask or feel free comfortable about. So I think you should always have a provider that you're 100% comfortable talking, not only, from the time if you have a sickness, headache to, your sexual health, everything.
I'd say my biggest takeaway is that, and just keep the conversation open with your spouse, significant other, friends, family, whoever else. Just kind of work on breaking down the taboo around it.
Yeah.
Just because everyone does it, everyone thinks about it. It's nothing crazy. We've been doing it for thousands of years. So it's just, why not talk to people about it? Make sure that your life is the same as theirs type situation.
And maybe not learning all the moves from the internet.
Yes.
Not showing up with the pizza.
Yeah. Is getting advice and experience from other people, whether it be a provider.
Yes. People that are reliable, not maybe.
Yes, not porn actors or something like that.
Exactly. Yeah, you want education that's actually based. And again, talking to your partner. I mean, if you can't find the clitoris, just ask. I'm sure
they know where it is.
Yes. A woman can tell you exactly where it's at. And if you don't know where yours is, then you need to find yours.
Put the mirror down there.
Yes, find yours first, so that way you can direct anyone to it.
My biggest takeaway was for sure that absolutely what you guys said, keep the conversation open, talk to your partner, but also that sex should not hurt, right? Like sex should be a positive experience where both parties are enjoying it, whether it's female, male, whatever. It doesn't matter what your cup of tea is, but regardless, it shouldn't hurt, and you need to find the things that work for you and your partner to have the best experience. So that definitely goes hand in hand with keeping the conversation open. And, as a wellness clinic, we're always here to talk about it with our clients. You can always walk in and ask us questions anytime. We're always here for you guys. So that was kind of my thing. I just want to reiterate.
Yeah, I agree with the pain. And that's where the vaginal tone really comes into play, because the more foreplay, the more you can relax your partner, and that your vagina elongates, opens up, and allows for that penetrative sex. When you're nervous, scared, maybe you don't want it. I mean, all of those, you're going to get tense and tighten up, and that changes that vaginal tone and will make it discomfort or painful. Just as if you were a virgin and having intercourse for the first time. That's usually not all that pleasurable because it is the vaginal tone in there. So so important. You should not be having pain, or if there's anything that you ever need to talk about. Even Mariah, I know you've talked to several people just about, sexual health, but maybe unwanted bad relationships, or where maybe it was a relationship. And although I know when we're in a relationship, we don't think we are raped by our spouse, but that can happen. You can be raped by your spouse or significant other. And it's hard because you love that person. So you take it as that's being loved, but that's not always the case. And that is something I know you've talked to several patients about in the past, and I feel comfortable with that as well. So that is something else you can really seek out Mariah for if you need to talk about that, and she can get you to the right spots and the right places for that as well. If you have had any abuse or feel like you're in a bad relationship or anything like that, please reach out. Or you can reach out to us too, and we can get you to the right help. There's plenty of places in town that can help with that as well. All right. Well, I would like to thank you all for joining Revive 360. Great talk. Again, if you have any questions, even after this episode or any other episode, you can always email questions to admin@azrevive.com. Or if you have questions for an upcoming show, please email those out so we can make sure we answer any of those questions.
And next week, we're talking about CBD. Yay!
Yay, CBD. I was not a believer until a month or two ago, and I was having terrible shoulder pain, and you put some on my shoulder, and I think it was gone in like 10 minutes.
Yep.
So was not a believer at all of it, but now I am. It works really well. So yeah, join us next week for CBD. And again, like us on Facebook, ring the bell,
subscribe on YouTube.
And we'll see you next week.
Thanks for
See ya.
coming.